வணக்கம் நேயர்களே, மீண்டும் மற்றும் ஒரு கேளுங்கள் தரப்படும் நிகழ்ச்சியூடாக உங்கள் அனைவரையும் சந்திக்கின்றோம். கடந்த வாரங்களில் பெற்றோர் பிள்ளைகளுடைய நல்லுறவு பற்றி பேசியிருந்தோம். ஆனால் துரதிர்ஷ்டவசமாக 6 இல் 1 தம்பதிகளுக்கு குழந்தை பாக்கியம் இல்லாத ஒரு புள்ளி விவரம் இல்லாதது என்ற ஒரு புள்ளி விவரம் கூறுகின்றது. அதுக்கு கனேடிய தமிழ் மக்கள் விதிவிலக்கல்ல. ஆகவே இன்றைய நிகழ்ச்சியில் நாங்கள் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் என்ற தலைப்பில் டாக்டர் சாலமன் அவர்களுடன் பேச இருக்கின்றோம். தொடர்ந்து இந்த உரையாடல் ஆங்கிலத்தில் எடுத்துச் செல்லப்படும். Just to give you a brief introduction on Dr. Solomon, he's been treating infertile patients from the year 1994, and he runs his own clinic from year 2005. It's called New Life Fertility Center. So it's a pleasure to have Dr. Solomon with us here today.
Thank you.
So we would maybe start off with, in the long run today, we are going to talk about what the underlying causes of infertility is and how some of them can be treated. But I haven't to be particular, reviewed my biology in the longest time. So maybe if you can start off with what the male and female reproductive system is like and what should be normal.
Well, I mean, when you talk about infertility, people need to know what really constitutes infertility, because I do see patients that come really early, after 2 or 3 months, and they think, well, why aren't we pregnant? But generally speaking, it's you have to wait for approximately a year if you're young, and if your age is over 35, then we do not recommend waiting more than 6 months in terms of seeking help. In terms of anatomy, I don't know if audiences can see the pictures, but the female anatomy, you have to have normal tubes, open tubes to be able to get pregnant. You have to have a normal uterus, things like fibroids and other things inside the uterus that can affect fertility we look at. And of course you have to be ovulating normally, so the ovaries have to be functioning normally, and just able to have the normal intercourse. Otherwise you can't get pregnant. And the same for the male. They have to be producing normal sperm, and the sperm numbers have to be adequate. The number of sperm that are motile, that are moving, and the other thing that a lot of people don't know about is also the shape of the sperm. So there's a lot of things that affect fertility, both on the male and the female side.
And what are some main types of infertility that are faced by men and faced by women? Because I realize some of them are genetic, it comes at birth, but majority of them, or there are quite a number of them that are acquired throughout their life, and like you mentioned, age is also a factor. So what are some main infertility issues that are faced by men and by women?
Well, in the case of women, the biggest thing that scares everybody is age. Age is the biggest issue when it comes to women, and the chance of pregnancy starts declining from 32 years of age by about 4% per year. So it's quite a significant drop. And over 40, it becomes really, really difficult. And for some people over 42 or 43, it's almost impossible to get pregnant. And a lot of people don't know that, especially that people are delaying having children or getting married really late, or by the time they come to Canada and find a suitable husband and so on, it can be a problem. So age in women is a big issue. In men is not as important, although it does have effects, especially over 50 and 60, it can have some negative impacts. But other things, of course, tubal disease, and that can happen from infections, that can happen in young ladies. Things like having unprotected intercourse or ending up with infections, of course, that can damage the tubes. Polycystic ovaries, mainly related to some genetics, but also weight gain can be a problem. So extremes of weight are a big problem, of course, for both men and women. But particularly for women, weight gain can stop ovulation. And extreme weight loss can also stop ovulation.
Right.
So there are, many things, but generally speaking, the factors are divided almost equally between men and women.
And are there lifestyle changes or habits that men and women can develop over the years to make sure that they don't become infertile later on in their life?
Yes, of course. There's a lot of things that you can do to damage your fertility, and you can avoid doing so that you don't affect your fertility. So things in young boys, for example, injury, like horseplay and injury to the genital area can cause infertility later on in life. So that's important for little guys to make sure they don't play that kind of play where to hit especially the genital area. In women, of course, is getting protected from getting infections in their tubes, things like chlamydia and gonorrhea, and sexually transmitted disease, which can damage the tubes. Smoking is a very big thing. It cuts the chance of fertility by 50% in both women and men. So that's another big thing that people don't know about, and it can cause irreversible damage actually in women. And just weight. Yeah, these are the things that are acquired. And of course, there's a lot of environmental exposure, like people who work in chemical factories or sometimes gas stations, where they are exposed to toxic fumes, gas, or almost anything you can smell can be toxic.
Right.
And that does affect fertility.
And I routinely run into a lot of information on alcohol and also caffeine consumption, and the research reports are usually they just kind of flip-flop back and forth. So does caffeine have any negative effect on fertility?
In women, it seems to be, there is, yes, increased risks with infertility and miscarriages, and that's for people who drink more than 2 or 3 cups a day of coffee. So there could be some negative impacts. In men, it doesn't seem to be an issue. Heavy alcohol use, of course, in men and women is detrimental.
So when there is a couple who are infertile, when do they choose, or when should they decide it's time for a consultation with the clinic, or to at least go through the process for just to even check and make sure their hormone level and their physical reproductive system and the structure is all ready? Yeah,
that's a very good question, because I do see people that can come really early, but I more often see people that have been waiting for years to come, before they come to see me or see a fertility doctor to try and help. And basically, any couple that are under the age of 35, if they've been having unprotected intercourse for a year or more, and they cannot get pregnant, should come in and see a doctor that specializes in this area and get checked. If the woman's age is over 35, that duration should be cut down to only 6 months, just because they don't have the luxury of time and waiting. So that's really important. And for women that are not regular, if they're not having regular cycles every month, then there's no point of waiting, because pregnancy is not going to happen if you're not regular. And if a woman has had surgery, for example, on her ovaries because of cysts, or these people are at high risk for infertility, and they should seek help earlier than later. Or if they already know that there is a problem in the man, for example, who has a problem, or he had an injury, or he had surgery when he was a child on the testicles, for example, they would need to see somebody much earlier.
All right. நேர்கள் பார்த்து கொண்டிருப்பது கேளுங்கள் தரப்படும் நிகழ்ச்சி. இன்றைய நிகழ்ச்சியில் நாங்கள் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக டாக்டர் சாலமன் அவர்களுடன் பேசிக் கொண்டிருக்கின்றோம். நிகழ்ச்சியில் கலந்து கொள்ள நீங்களும் அழைக்கலாம். 416-623-8100. உங்களுடைய கேள்விகள் அல்லது கருத்துக்கள் அல்லது இது சம்பந்தமான விடயங்களை நீங்கள் தமிழிலோ ஆங்கிலத்திலோ முன்வைக்கக்கூடும். ஆகவே மீண்டும் அறிய தருகின்றோம். அலையுங்கள் 416-623-8100. So we talked about the stage of when somebody should consult a treatment clinic. So generally, what is involved in an initial consultation? So when you have a couple coming in, walking into your clinic, what would you do? You'd obviously sit down and speak with them about their special particular case. What kind of tests are involved?
Yes, usually they come in for a consultation. We take fairly extensive history about what could be the problem. In terms of testing, of course, they have an ultrasound to see if they have any fibroids, make sure they're ovulating properly. We do blood tests to check their hormone levels. And we do a dye test to check their tubes, make sure the tubes are open. And of course, we do a semen analysis on the male partner to make sure that they have normal sperm. And then after that, we meet again and discuss what we found, and then move on with treatment.
All right, we have our first caller today. Selvi அழைப்பில் இருக்கின்றீர்கள். வணக்கம்.
வணக்கம்.
ஆமாம்.
ரெண்டு பேருக்கும் வணக்கம். நான் இங்கிலீஷ் பேச கலைக்க மாட்டேன். தமிழ வாங்கிக்கலாமோ?
ஆமாம், தமிழில் சொல்லுங்க.
ஓ சொல்லி எனக்கு 43 வயசு. முதல் பிள்ளை 99ஆம் ஆண்டு பிறந்த 8 நாள்ல பெற்றது. அடுத்த பிள்ளை 2007ஆம் ஆண்டு மிஸ்கருவாயினது. ஒரு வருஷம் 1 இயருக்கு முன்னும் ஒரு 2 மாசத்துல மிஸ்கருவாயினது. அப்ப அதுக்கு என்ன செய்யலாம்?
சரி, அவருக்கு 3 மிஸ்கேரேஜஸ் ஆகியிருக்கின்றதா? 8 நாள்லையா?
8 நாள்ல.
and then மற்ற 2 மிஸ்கேரேஜ் ஆனதா?
மிஸ்கேரேஜ் ஆனது. அது முழுசா அப்புறம் அந்த தண்ணி போகாம 8 நாள்ல ஹாஸ்பிடல்ல எடுத்துட்டாரு.
இப்போ அவருடைய வயசு என்ன?
உணவு கல்வாயும் மூச்சு கல்வாயும் ஒன்றா சேர்ந்து வந்துடுது.
இப்போ அவருக்கு 43 வயசா?
49 வயசு.
49ஆ?
ஓ.
சரி, நான் அந்த கேள்வியை அவரிடம் முன்வைக்கின்றேன். நன்றி நிகழ்ச்சியில் கலந்து கொண்டமைக்கு.
நன்றி.
So she talked about a friend of hers who had a baby that died in 8 days, and then after that she's had 2 miscarriages, and now she's 49 years old, and she's asking if there's anything that can be done, or I guess she's looking for what could have gone wrong, or what kind of treatment may be possible for her.
Yeah, at 49, it's going to be a problem. There is still a good chance of pregnancy at that age if they decide to use donor eggs. Yeah, with donor eggs, the chance of success is quite high, actually. Yeah, it's around 70% per try, and most people get pregnant as long as they're able to get donor eggs. Now, people should know what donor eggs are. That means eggs are coming from a younger woman, and that could be somebody they know or somebody else that they do not know.
So in a case like this where they may not be using, or it may not be fertilizing the best quality egg, what are some treatments that are available for a woman like her who might want to use her own eggs? Is that a possibility, or?
At 49, no.
No, okay. No. So her best bet is to rely on a donor egg.
The only choice would be donor egg IVF in this case. And the reason for the miscarriages are, again, because of the egg quality, which declines significantly from 30 to 1, like I had said earlier, yes.
Right. So just to quickly go over, I said I'm still rusty on my grade 6 biology. So women are born with a certain set of eggs. So starting from their menstruation to menopause, that's when they are fertile.
That's right. Every woman has a number of eggs that does not change. It declines through even inside the uterus before they are even born. The number of eggs go down, and throughout life, each month there is around 200 to 300 eggs that get consumed, and it doesn't matter what you do, even if you're on the birth control, even if you're pregnant, they're still consumed. And so at a certain age, obviously, all women will reach, menopause or premenopause, like in the case where they start having difficulty getting pregnant, infertility, and recurrent pregnancy loss. So that is something that you cannot really change.
Well, you mentioned earlier that a lot of women these days are having kids later and later on in their life. So is there something they can do, maybe like freezing the egg when they're at a younger age so that they can use it later on in their life?
Yes, egg freezing is a new technology.
Okay.
It's been available in the last 4 to 5 years. And the results are becoming very good in terms of success to use them later on. And we've done quite a bit of egg freezing, and we've had children born from frozen eggs. We're probably one of the only clinics in Canada that have had a good number of children born to frozen eggs. But worldwide, there's been lots of children born to frozen eggs. There's only around between 1,000 and 1,500. So you can imagine it's a fairly new technology, but it is available, yes. Yeah.
And how about the sperms? Because the way sperms are, they work totally different from the eggs.
That's right. In men, there is no real decline in sperm quality and numbers as they age. There is some decline, but it is not the same as in women when it comes to eggs. So, an 80-year-old man could still have children. Obviously, the quality of sperm will be less. It'll be more difficult to get pregnant. But obviously, because the woman is the one that has to carry the baby, nature has decided that this is the age where, beyond that age is not safe really to be pregnant.
So what would be the best age for a woman to have a child? Because I've read different things. Some people say it's 21, some say it's mid-20s.
Well, what we tell people is it's not a good idea to delay having children if you are socially able to have them. If you have a partner, you're married, don't put things off until, you buy the house or you get a career or whatever, because if you leave it, the more you leave it longer, the harder it gets to have a baby. So actually, as a prevention of infertility, it would be good for women to try and have their children as early as possible, whenever they're able to. But yes, generally speaking, over 21, till 32 is a good idea. People who wait after that, they need to speed things up. They can't just leave it for a long time.
Okay. So infertility it's a very sensitive issue.
It is,
between the partners. So would you advise people to seek counseling, or are there psychologists that would be recommended for the couples to talk?
Yes, it is quite sensitive, very stressful, and a lot of couples actually end up separating over fertility issue, because it's such a big thing. And people get married and they go into the relation thinking they're going to have a family and have children and so on, and when things don't work out, well, you can imagine it's a big shock and a big stress. So we routinely offer couples to talk to counselors, and they have to understand everything. They have to think they're doing the best they can. They're following treatment, they're trying their best, and that's all you can do. You can't really start blaming your partner or fighting with your partner. It's not going to help. at all.
Right.
It just creates more problems. And so it's important to have a bit of perspective, yes.
And even in terms of, even as you're going through stages of the treatment, I think it's important to have someone to speak with. Because once you get that call from the clinic saying, yes, everything is okay, or sometimes they may have to hear a no, it's not working out this way, right?
Yes.
So,
yeah, I mean, it's important. There's a lot of support groups, and of course the internet is, lots of resources, and we do offer people counseling routinely. And of course our nurses do that, and I do that. Everybody talks to them, and people have to just understand where it is. The biggest problem I find is people who don't understand, and because they're so stressed, sometimes they don't listen to what you say. So it's quite stressful, obviously, and they need to know that. I tell them it's like a marathon. It's not like a stint.
right.
You got to give yourself 6 months to do some treatment and get pregnant. It's not gonna. Sometimes it happens in one cycle, sometimes it doesn't. And each cycle you try, it's only once per month that you can get pregnant.
Right.
So 6 months is only 6 tries.
Six tries, that's
yeah,
true.
it's not 100 tries or 50 tries, only 6 times.
Right, you got to wait for your
So you got to
cycle.
give it a little bit of time and understand the process and do your part. Whatever. If you smoke, you stop smoking. Carry on with the treatment, do whatever needs to be done. I find some people they get stressed and then they stop treatment and then they disappear for a few months and they come back and they think they've been doing something, but they haven't been doing anything.
That's true. What is unexplained infertility?
Yes, that about 20% of couple will have what we call unexplained infertility, and I tell people it's not really unexplained. It's still explained. We find what it is at the end, but when we do the initial testing, check the tubes, for example, do the semen analysis, check ovulation, everything seems to be normal. So we call them unexplained infertility, and they're actually highly successful as long as they don't have a big problem in the eggs and their age is okay. When you talk about unexplained infertility in a woman who is close to 40 or over 40, you're going to be in trouble because it's mainly related to egg quality. Yeah. So and then of course there are some young patients that everything seems to be normal, but the sperm and the egg do not connect. They have failure of fertilization. And they get pregnant still if you do IVF. If you do test tube babies, then they get pregnant. The only ones that have trouble if there is an egg problem. And even those, they still do get pregnant, but it might take them a little bit longer. Yeah.
All right, next we'll take a little short break. சரி நேயர்களே, நீங்கள் பார்த்து கொண்டிருப்பது கேளுங்கள் தரப்படும் நிகழ்ச்சி. இன்றைய நிகழ்ச்சியில் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக பேசிக் கொண்டிருக்கிறோம். ஒரு சிறிய இடைவேளையின் பின் நிகழ்ச்சி தொடரும். நேயர்கள் பார்த்து கொண்டிருப்பது கேளுங்கள் தரப்படும் நிகழ்ச்சி. இன்றைய நிகழ்ச்சியில் நாங்கள் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக பேசிக் கொண்டிருக்கின்றோம். நாங்கள் ஏற்கனவே குறிப்பிட்டது போல் ரீப்ரொடக்டிவ் இயர்ஸ், ஒரு குழந்தை பிறக்கக்கூடிய காலத்தில் இருக்கும் தம்பதிகளில் 6இல் ஒருவர் இன்ஃபர்டிலிட்டியினால் பாதிக்கப்படுகின்றார்கள் என்று கூறியிருந்தோம். ஆகவே இது சம்பந்தமாக உங்களுக்கு இருக்கக்கூடிய கேள்விகள் அல்லது கருத்துக்களை முன்வைக்க நீங்களும் அழையுங்கள் 416-623-8100. இன்றைய நிகழ்ச்சியில் நாங்கள் நியூ லைஃப் ஃபெர்டிலிட்டி சென்டரிலிருந்து டாக்டர் சாலமன் அவர்களிடம் பேசிக்கொண்டிருக்கின்றோம். Earlier on we talked about some of the common issues that are faced by men and women in the Tamil community, and you brought up PCO as one of the syndrome that are most commonly faced by women in the Tamil community. So if you can expand a little bit on that.
Yes, it is one of the most common issues that I see, common problems, especially in the Tamil community. And basically these are young women that don't have regular cycles. And sometimes they have it all their life. More often it develops when they get married and they come to Canada. There's more stress and there's a change of lifestyle. cold weather, less activity, so they end up gaining weight. And it seems like there is a bit of genetic predisposition in the Tamil community. So a lot of women, when they do gain weight, their periods will stop. And they start developing hair, facial hair, acne, and they can't get pregnant. It's a very, very common condition that I see. Approximately 1/3 of patients have this problem. And the treatment is pretty easy, but also difficult because losing weight is not that easy, of course, especially with the change in environment and the cold weather and stress and everything else. People and the food that's may not be very healthy.
Right.
Then it becomes a big problem, and the treatment is fairly simple. Most of them just need medication to make them ovulate, and if they can lose a little bit of weight, then it helps. There is a proportion of them who will not get pregnant even after becoming regular. And in those cases they require IVF, and almost all of them will get pregnant because they have lots of eggs, and they do very well. But I do see a number of patients who have been irregular for years, and they didn't do anything about it. And unfortunately, sometimes the family doctors don't know about it. And they just tell them it's okay, you're not having a period, it's all right. But it's not okay.
Right.
It's not okay. It's actually quite dangerous, even from health-wise, not from the fertility point of view alone.
But even for the individual's health.
Even for women that are not trying to get pregnant, it's quite dangerous. The danger is that if you don't have regular cycles when you're younger than 50, the lining can get very, very thick, the lining of the uterus, and then you can have very heavy bleeding. Women can hemorrhage. They can hemorrhage, lose all their blood. And also, unfortunately, I've seen a number of cases where the lining turned into cancer. So it's a serious health issue.
Right.
So women in the reproductive ages that are not into menopause should always be having regular periods. There is no such a thing as somebody not having periods.
Right, and they should consult their doctor right away.
Absolutely, and they have to demand something to be regular. And usually, if a woman is not interested in fertility at all, they don't want to get pregnant, they already have their kids, they still have to be regular.
Right.
And the best thing to do that is to take the birth control, because it just makes them nice and regular, and that's it, until they stop, until they're over 50.
Right.
And that's very, very important. I see too many people with problems because of that. Yeah.
All right, we have another caller online. Bala அழைப்பில் இருக்கின்றீர்கள். வணக்கம்.
வணக்கம்.
பாலா, அங்கே இருந்து பேசுகிறீர்கள்?
நான் மொந்தியிலிருந்து கதைக்கிறேன்.
ஆமாம், கூறுங்க.
நான் மொந்தியிலிருந்து கதைக்கிறேன். நான் மொந்தியில இருந்து.
ஆமாம், பேசுங்க.
என்ன வைஃப்க்கு நான் ட்ரீட் பண்ணணும்னு செய்தேன். அவன் டியூப் ரெண்டும் டேமேஜ் ஆயிருந்து எடுத்துட்டான். அதனால நான் ட்ரீட்மெண்ட் செய்தேன். ஒரு செய்க முறையில அது சரி தெரியல. திரும்பவும் அதை அப்படி செய்யலாமோ?
விளங்கவில்லை, மீண்டும் கூறுங்கள். அவருக்கு 2 டியூப்லையும் பிரச்சனை இருக்குன்னு சொன்னீங்களா?
ஆமாம்,
எடுத்துட்டினம்.
ஆமாம், அதை எடுத்துட்டினம். ப்ராப்ளம் வந்து அப்ப எனக்கு ஒரு பேபி வரும்போது நான் ட்ரீட்மெண்ட் செய்யலாமா திரும்ப?
மீண்டும் கூறுங்கள், நீங்கள் சொல்லுவது தெளிவாக விளங்கவில்லை. அவருக்கு இப்பொழுது யூட்ரஸ் இப்ப எல்லாம் சரியாக இருக்கின்றதா?
சரியா இருக்குது.
ஆமா, தொலைக்காட்சியின் ஒலியளவை குறைத்து வைத்துவிட்டு தொலைபேசியில் பேசுங்கள்.
ஆமாம். ஓகே.
ஆமாம், சரி, மீண்டும் ஒரு முறை கூறுகின்றீர்களா? அவருடைய
நான் ட்ரீட்மெண்ட் செய்தேன்னா நான் போய் செய்யல, இந்த பேபி ப்ராப்ளம் இருந்தது. ஹலோ,
ஆமாம், கூறுங்கள், கேட்டுக்கொண்டிருக்கிறேன்.
நான் ட்ரீட்மெண்ட் செய்தேன். போக்குல அவர் சொன்னா இந்த டியூப் வந்து ப்ராப்ளம்னு சொன்னேன். டியூப் வந்து ப்ராப்ளம்னா டியூப் ரெண்டையும் எடுத்துட்டேன் கர்ப்பப்பையில இருந்து.
ஃபலோப்பியன் ஓவரிஸ் எடுத்துட்டீனமா?
அது அந்த பேபி ஒன்று வச்சுனா சரி வரையில திரும்பவும் அப்படி ஒரு
சரி நன்றி பாலா நிகழ்ச்சியில் கலந்து
அதை
கொண்டமைக்கு.
கேட்டீங்க எனக்கு இப்ப சொல்றீங்களா தமிழ்ல?
Sorry, Nandri Bala. It was unclear what he was saying. He said they removed the tubes for his wife, and he's asking if there are chances of having children.
Yes, if the tubes are removed, as long as the ovaries have not been removed, and she has reasonable ovarian reserve, she's got good ovaries and everything's fine with ovulation. Yes, they can get pregnant with in vitro IVF, and if they have OHIP, OHIP covers a good portion of the IVF, so it's a lot less expensive than if the tubes are open. So it's not bad, and the results are good. So it really depends on his wife's age. If she's if her age is okay, and she has good ovarian reserve, which we check, we just do ultrasound and blood tests. Then the chances are good, yes.
Okay, so we were talking about PCO earlier on, and I just wanted to know, would they have, let's say once it's regulated, would they have any issues when they're pregnant? Like if they had PCO and if it's treated or if it's corrected, is that okay for them to get pregnant later on? And
Not usually, no.
Okay.
They do very well once they're pregnant.
Okay.
It is likely, though, that they will need help for their next baby as well. But during pregnancy, no, they don't have any issues at all. They're like anybody else. The only thing they have to watch is the weight, especially if they are that type of PCO patients that is overweight.
So we've been talking about treatments and how expensive, like how economical are these treatments generally?
Yes, that is a good question, because a lot of people are afraid of even going to talk to a fertility doctor because they think once you go into a fertility doctor, it's going to cost you a lot of money. But that is not true. That's not true. If they have OHIP coverage, if they have health insurance, the provincial health insurance, it covers most of the treatment. So, initial consultation, all the tests that we do to check their fertility is covered. If they need medication to help them ovulate, for example, in the case of PCO, then like everybody else, they have to pay for the medication, or a lot of people have drug insurance that covers medication. So for most people, it's fine. They don't really need to pay a lot of money or anything like that. And I find a lot of people don't want to go into a fertility clinic thinking once they go in, it's like a plastic surgery clinic or something. They have to pay for everything, but that's not true, because fertility treatment is mostly covered. The things that are not covered, of course, is IVF, test tube babies, and procedures like IUI or sperm wash, artificial insemination. The cost for that can be between $400 and $600 per cycle. So it's expensive, but not impossible. And the IVF, of course, is expensive. It can range between $4,000 and $8,000 for IVF.
So we've heard some brief names of the treatments like IVF, and so some of them, like I said, would be easier to understand, and some of them are a little intricate. So what kind of treatments, like if you could name a few common treatments that are available for infertility? You can talk specific to men and women and combined.
Well, for men, there's not a whole lot of treatment really you can do for men if they have issues with sperm problems. I do put men on supplements to help the sperm. They usually get an ultrasound to see if they have varicocele or veins around the testicles, and then if need to be, they can have surgery for that to improve the sperm counts. For women, there's a number of treatments. One of them, of course, is surgery. If there is somebody who have endometriosis or has cysts or have tubal problems or something, or fibroids, or something that needs to be fixed with a surgical procedure, we do that, and that is covered by OHIP, so it doesn't cost the patient anything. So surgical treatment is an option. Other things that are very common for people to use is oral medication, for example, things like Clomid, fertility medication, basically, that boosts the ovulation and helps you get pregnant. And that's not very expensive either. It costs somewhere around $40 to $100 per month. So that's available. And then the more complicated treatment, more expensive treatment include sperm wash, artificial insemination, and in vitro fertilization, which is the ultimate treatment, as the most successful treatment that we have. But most people, have fears about IVF and misunderstanding. IVF for some people is highly successful, and usually they make multiple embryos. And in a young person, we would only transfer 1 or 2 embryos. And they would able to use the extra embryos. We freeze the other embryos, and they can use them for their next baby. Right. So a lot of couples actually will have 2 or 3 children from 1 cycle of IVF. So it's quite effective, and it helps.
Right. So you've talked about a number of treatments. In case of failure, I think that's what the caller from Montreal, Bala, was also asking. He said he had, that's the one with the tubes that were taken out, and he said they tried it once and it failed. So would you advise them to try the same treatment again, or should they be trying a different treatment in case one fails?
Well, it depends on really the particulars of that patient. But if his wife's age is young and she has a good number of eggs, then of course trying it again is a good idea. But if there is a big problem with the eggs, which they should be able to tell them from doing 1 cycle of IVF. For example, if she did not produce a lot of eggs, or the embryo quality was not good, in that case, donor eggs would be a much better option. Yeah.
ஆக நாங்கள் ஏற்கனவே பாலா கேட்டிருந்த கேள்விக்கான பதில் இப்பொழுது வழங்கியிருந்தால், நீங்கள் ஏற்கனவே ஒரு முறை ஒரு இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் முயற்சி செய்து அது சரியாகவில்லை என்றால் நிச்சயமாக அத்துடன் நிறுத்த வேண்டிய அவசியமில்லை, நிச்சயமாக இன்னொரு தடவை முயற்சி செய்யலாம் என்று கூறியிருக்கின்றார். அடுத்ததாக ராஜா அழைப்பில் இருக்கிறீர்கள். வணக்கம் ராஜா. ராஜா அழைப்பில் இருக்கின்றீர்களா? சரி. So we talked about the different types of treatments, and of course all of these clinical surgeries or treatments do have a little bit of a side effect or an after effect. How is the after effect in comparison to the treatment itself? Like, there's probably medications and things that patients can do.
Well, a lot of people are afraid of the side effects of fertility treatment, but things have improved actually quite a bit. We're very, very careful about causing any problems with fertility treatment, because the most important thing obviously is to protect the patient, is not to cause any harm. Right. Of course, you want to have a baby, but not at any cost, right? You have to be very, very careful, and of course, it depends on the doctor and the clinic. For example, we have not had the biggest issue with fertility is hyperstimulation, where a woman can make too many eggs, and they can get sick, and some of them have to be admitted to the hospital. And they get bloated, and they have to have things done, treatment done. And we haven't had anybody have that in the last 4 years, not once, because we're very careful. We're using medications to avoid it. Right. We also often we don't put back the embryos the same cycle. We actually freeze them and put them back in a natural cycle, so that there's no drug effects on the body, and that could be worse when somebody gets pregnant with these drugs on board. So we're very careful with side effects. I find the biggest side effect of fertility treatment is stress and cost.
Right.
And for cost for some people, it's a problem, of course. And unfortunately, in Ontario, because expensive treatment like IVF is not covered, for some people they cannot afford it. They can't do it. We do help people. We give people discounts if they need, if their income is low. But still, for some people, even if you give them a 30 or a 40% discount, it's still
not enough.
Still expensive for some people. Yeah.
All right, thank you. அடுத்ததாக நாங்கள் ஒரு சிறிய இடைவெளியை எடுத்துக்கொண்டு நிகழ்ச்சியை தொடர இருக்கின்றோம். இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக இன்றைய நிகழ்ச்சியில் பேசிக்கொண்டிருக்கின்றோம். இதில் கலந்து கொள்ள நீங்களும் அழைக்கலாம் 416-623-8100. நேர்கள் பார்த்து கொண்டிருப்பது கேளுங்கள் தரப்படும் நிகழ்ச்சி. இன்றைய நிகழ்ச்சியில் நாங்கள் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக டாக்டர் சாலமன் அவர்களிடம் பேசிக் கொண்டிருக்கின்றோம். இதில் கலந்து கொள்ள நீங்களும் அழைக்கலாம் 416-623-8100. இதில் அவர் கூறியதில் முக்கியமாக பெண்கள் கருத்தில் கொள்ள வேண்டிய விடயம் ஒன்று, குறிப்பாக தமிழ் பெண்கள் மத்தியில் அவர் காண்பது PCO, அதாவது Polycystic Ovaries syndrome என்று குறிப்பிட்டிருந்தார். உங்களுடைய menstrual cycle ஒழுங்காக இல்லாவிட்டால் நிச்சயமாக உடனடியாக உங்களுடைய ஃபேமிலி டாக்டரோ அல்லது ஒரு இவ்வாறான கிளினிக்குடன் தொடர்பு கொள்ள சொல்லி கூறியிருக்கின்றார். தொடர்ந்து இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட்டுடைய ரிசல்ட்ஸ் எவ்வாறாக இருக்கின்றது பற்றி பேசிக்கொள்ள இருக்கின்றோம். Alright, so we were talking about the treatments so far, and if you can briefly mention about some of the results, because you've been treating patients from 1994, it's about 18 years so far. So you would have seen a lot of results with parents coming back with their children. So how has that been?
Well, it's been great. It's very gratifying to see, of course, good results. But for people, they need to put things into perspective. So, each month it's one try. So I tell most of my patients that it can, take up to 6 months of treatment before, you get pregnant. Some people are lucky and they get pregnant right away. Almost everybody gets pregnant. It just depends on what treatment they want to go to, and sometimes it can also come to affording the treatment.
So in general, like we are sort of coming to the end of the show. What are some important things that you would want to tell couples?
Well, I would tell people who are married or in a relation in a position to be able to have kids, don't delay having kids. Don't put it off. Even I see people who have had one child and then they wait for 7-8 years before they have their second child, and then they have problems afterwards, even though they didn't have problems earlier. And so I tell them, if you want 2 or 3 kids, try to have them as early as possible. Don't put it off, because waiting is your biggest enemy because of the woman's age. If you're having problems, if you're not having a regular cycle, or you've had surgery, or you've had a sperm problem, see somebody earlier. Go see a fertility doctor, and don't put it off, because if it hasn't happened for a year or 2 or 3, it's not going to happen just by waiting. A lot of people have this myth, and actually sometimes the family doctor will tell them to just keep trying. That is not a good answer. If you're not able to get pregnant after a year, you should see somebody. You need at least get checked, get the information. You don't have to do anything, but at least just see somebody, find out what's going on, see what your options are, and check it out. And I understand it is a difficult thing for people to do, because for everybody it is a taboo going to see a fertility doctor or feeling that they're not able to have children. But for most people, time is very, very important, because waiting that extra year or 2 can make a difference of actually being able to have a child or not being able to have a child.
So time seems to be a big factor there.
Time is a big issue, yes.
சரி நேயர்களே, அவர் ஏற்கனவே கூறியது போல் நீங்கள் ஒரு ரீப்ரடக்டிவ் இயர்ஸில் இருக்கக்கூடிய தம்பதிகளாக இருந்தால் காலதாமதமாகாது நேரத்துடன் உங்களுக்கு தேவையான ஃபெர்டிலிட்டி ட்ரீட்மெண்ட்டை எடுத்துக்கொள்ள கூறியிருக்கின்றார். அடுத்ததாக மகிதினி அழைப்பில் இருக்கின்றீர்கள். வணக்கம்.
வணக்கம்.
எங்கிருந்து பேசுகின்றீர்கள்? சரி, கூறுங்கள்.
For the irregular period, Dr. Sinawal birth control pills எடுக்க சொல்லி. Is it safe to take it for the longer period of time? So that's my question, because some people say that it will create a blood clot later on.
What age are we talking about?
Now I'm 36.
Okay. So உங்களுக்கு birth control pills என்னத்துக்காக எடுக்க சொன்னவர்?
No, for the irregular period.
For irregular periods.
Yes, yes.
சரி. அந்த கேள்வியை நான் அவரிடம் முன்வைக்கின்றேன். So she says she was advised to take birth control pills for irregular periods. Would that have an impact on her later?
No, in terms of fertility, no. Actually, it actually protects her until she is able to have a child. The only impact is delaying fertility. So if she's 36, you probably don't want to wait for too long. So if she wants to have a child, it would be best that she, instead of waiting for another year or two, is to have the child now. Because when she's 37 or 38, well, it's that much harder to get pregnant. So I wouldn't recommend it. If she's planning to have children, she should have her children now. If she's not planning on having children, then being on the birth control is a perfect solution until she's able to have children.
So even if your menstrual cycle has become normal, would it, like,
on
would
the
you
birth
have
control?
to, right?
No, if the cycle is regular and she does not need birth control to prevent pregnancy, then no, she doesn't need anything, no.
சரி, அவர் ஏற்கனவே கூறியிருக்கின்றார். அதை தமிழில் சொல்ல வேண்டுமென்றால், உங்களுக்கு குழந்தை பெற வேண்டுமாக இருந்தால் நீங்கள் பர்த் கண்ட்ரோலுக்கு செல்ல தேவையில்லை, ஆனால் அது எடுப்பதால் தொடர்ந்து உங்களுக்கு எந்த விதமான ஆபத்தும் இல்லை என்று கூறியிருக்கின்றார். So we were talking about some of the treatments and some of the taboo you mentioned. So a lot of people would turn to, instead of going to a fertility clinic and talking to someone, they have the tendency to turn to either internet, or they would research on books on their own, and then they would try out things that they come across. What's your advice on things like that? Is it better to consult somebody who's an expert in the field, or because it's very sensitive and there's a lot of stigma and taboo around it, people have the tendency to go off on their own and try things? What is your take on that?
Well, you have to be careful with the internet and information, especially on chat rooms and stuff like that, because there's all kinds of people are willing to give advice, but it's not really professional advice.
Right.
There are good internet sites, all the professional associations, probably fertility clinic websites, where you can get some good medical information. The problem comes when somebody would say, "Oh, it's okay to wait. Just keep trying. I did this, and I waited for 5 years, and I did get pregnant when I was 40." But that doesn't necessarily apply to everybody. One person's experience doesn't necessarily translate into, a good treatment for everybody. So you have to be careful, yes, what you follow. And it's like anything else. It's, you have to go to a professional to fix your car. You're not going to be doing it yourself. So it's the same kind of idea.
So I've mentioned it earlier on in the show that you have a New Life Fertility Center as your clinic. You've been running it from year 2005. So someone who's been watching the show on this infertility treatment, what can they expect? So just from initial consultation, just a quick maybe an overview of the entire process. So if they were to call you today, or if they were to walk in, what are they looking at? What is the timeline? It's very unique and individual to a particular couple. But what would they be looking at? What would they foresee?
Well, we are an accredited facility, so we are accredited by Accreditation Canada. Not all clinics are accredited, and so we have standards we follow, and we're accredited by the same organization that accredits hospitals in Ontario, for example, in all of Canada. So, we see patients fairly quickly. We don't make people wait more than 3-4, like maximum, I'd say 3 weeks for their initial consultation. Unlike, for example, if a patient is waiting to see a gynecologist, it could be 3 to 4 months before they see a gynecologist. And a lot of gynecologists do not do infertility treatment. So they push the people for fertility at the end of their waiting list because they're just not interested in that area, and they don't have the time to dedicate to that problem. So actually it's faster to see somebody who's specialized than it is to see somebody who does everything, delivers babies and does hysterectomy and all kinds of other things. So that's important, is access to treatment and access to consultation. And in terms of results, within one cycle, we sit with the patients and make a plan for treatment with them, whatever suits them. And I tell most of my patients they would expect to get pregnant within 6 cycles. And we don't like to just keep repeating the same thing. If they've already had treatment before, let's say from their gynecologist, we move on. We move on to the next step. We can't just keep doing the same thing.
All right. Thank you very much for joining our show and shedding some light on infertility and what some possible treatments are. And we hope to see you another time.
Thank you very much.
Thank you. சரி நேயர்களே, இன்றைய நிகழ்ச்சியில் நாங்கள் டாக்டர் சாலமன் அவர்களுடன் இன்ஃபர்டிலிட்டி ட்ரீட்மெண்ட் சம்பந்தமாக பேசியிருந்தோம். அவரை தொடர்பு கொள்ள அழைக்க வேண்டிய தொலைபேசி இலக்கம் 905-896-7100 905-896-7100 அல்லாவிட்டால் www.newlifefertility.com என்ற இணையதள முகவரி மூலமாக கூட நீங்கள் பல தகவல்களை வாசித்து பெற்றுக்கொள்ள முடியும். ஆகவே டாக்டர் சாலமனிடம் தொடர்பு கொள்ள வேண்டுமானால் www.newlifefertility.com அல்லது 905-896-7100. சரி நேயர்களே, மீண்டும் அடுத்த வாரம் இன்னும் ஒரு புதிய நிகழ்ச்சியூடாக சந்திக்கலாம். வணக்கம்.